Well, Aaron, so far no pink slips have been handed out, but the California Nurses Association is planning an informational picket this Thursday to emphasize their concerns about staff reductions and patient care here at Salinas Valley Memorial Hospital. Salinas Valley Memorial Hospital is one of Monterey County's largest employers, with more than 1,600 full and part-time staff. Last week, the hospital notified the California Nurses Association its restructuring effort to cut costs.
What they are trying to do is limit the number of part-time employees and try to force people to become full-time employees. And then whoever is kind of the last part of that move, if they're extra, they plan on cutting about 50 some odd nursing positions after that process happens.
It's not just nurses who are facing layoffs. Other positions, including housekeeping, food service, respiratory care, and nurses' aides.
Our concern, in especially some of the reports we filed, are not just about nurses and staffing, but it is that the cuts to the ancillary staff that are almost non-existent on the floors mean patients have less care in the areas that an aide would provide.
The hospital says the plans to restructure the nursing staff make sense. 75% of its nursing positions are part-time employees who receive full-time benefits, and that the layoffs won't impact patient care.
Patient care is our top priority, and so we are protecting that fiercely, and it will not be compromised with what we are doing right now. What we are doing is we're responding to the market, and our volume, at hospitals across the country, has declined, and as a result we have to respond to that, and that's good management. And so our administration has looked at what we can do to right-size the organization.
But the union says it's not just about layoffs. They're also upset with the $177,000 raise the hospital's chief executive officer, Pete Delgado, received, an increase that brings his salary to more than $600,000.
Our board, at the one-year mark of Pete Delgado's leadership here, reviewed his contract and gave him what they thought was a deserved increase. They put him at the 50th percentile of the market, and what that means is there was an extensive study done to what is the market for CEOs in this size hospital, and they wanted him to be right at the middle.
Well, the two sides have been negotiating since February, and with talks at a stalemate, the nurses are planning an informational picket beginning at 1:30 Thursday. Aaron?
All right, thank you, Phil. So the next round of negotiations isn't going to happen until at least September 8th between the union and the hospital.